Hello, everyone. I'm Solomay Tibabu, and I'm the host of the Expanding Access podcast, where we focus on all things expanding access to quality mental health, addiction, and IDD services through technology, health equity, and innovation. And I'm really excited to have both Paula and Matt join us today and really have a lot of great work to cover that you're doing at TELUS. And it's just such a delight to have you here. I think maybe just to get started, perhaps we'll go Paula, then Matt. If you could please introduce yourselves and just share a little bit about how you came into the field and your roles as well.
Yeah, I'd be happy to, and we're really happy to be here. As you said, I'm Paula Allen, and I started out with no real interest in mental health, actually, no interest in well-being. I was going to be a graphic designer or I was going to be a lawyer. Those were my two options. But I learned a little bit more about the impact of mental health on everything in life, and really what made the difference for me is seeing an image of a brain that was actually changing. It was changing structurally because the person was under unrelenting stress. And I could not get that out of my mind. Just the whole fact that your emotion, your environment, and what it causes in terms of your response to it could have that kind of an impact on your body, on your brain, which is, unbelievably important to everything in life. I just became quite focused on understanding more and quite happy that I did. So I started working with children and families, really got a good understanding of systems because a family is a system, and then moved into the corporate world, which is a big system. So disability management, health and benefits consulting, well-being, global training, always really focused on the research part of it to make good decisions. And I'm currently the TELUS Health Global Leader of Research and Insights.
Amazing. Matt?
Like Paula, I did not imagine that I would have a career in mental health. When I was attending medical school, I was interested in things like emergency medicine or intensive care, this really like intense type of, direct medical care during crisis situations. But when I started talking to patients, actually talking to people and listening, that's the most important aspect, listening to people's stories, I realized how much an impact you could make in the field of mental health. And so I changed gears and I rotated my career towards mental health. I trained as a psychiatrist, and then I further subspecialized as a child and adolescent psychiatrist. And like Paula, worked individually with youth, children, and their families. And then over time, just found that, there were just so many layers to the onion. You could do so much work, very, very rewarding work on an individual and family level. But I came to know that there were so many environmental and systemic factors that drive mental health outcomes that I just started coming out further and further out away from the individual level. I got involved in medical administration, teaching. I was the Regional Medical Association president in Western Canada during the COVID-19 pandemic. And then I ended up here at TELUS, where I have the privilege of being the Chief Mental Health Officer and affecting change for mental health for many millions of individuals on an international scale.
Amazing. Thank you both. Well, speaking of layers of the onion, Matt, that might be a good place to start. I know that the world has become really increasingly a complex place. Just financial stress, global uncertainties, cultural differences. Yet when someone's struggling, they need support to feel simple and immediate. And so maybe again, Paula and Matt, in that order, what do you think about this fundamental tension between the complexity of human needs and the simplicity required for effective care? And what does that mean for how organizations should approach employee well-being?
Yeah, it's a great question. And I'm going to go a little bit deeper in what you started with, which is the complexity of life. Like when we actually take a step back, you mentioned a few. We also have information overload. We have a lot of ambiguity, clear paths are just not there anymore. We have a pace of change that is accelerating. Even as we speak, it's accelerating. So, we have a lot of uncertainty. We have a high pace of change that people are not necessarily feeling that they have as much control in terms of their next step as possible. These are all things that the human mind doesn't like. And on top of it, we don't have as many of the supports that we historically have benefited from. So, we need to have other people, and there's much more isolation now than there ever has been. So, we really have a perfect storm right now where our society is not really geared towards a healthy mental state. And the supports that we have naturally in life are not really as strong as we would like them to be for many people. So with all of that, it's pretty complex. All of that, it's pretty draining. But the one thing that is really important is that if we are providing support, we can't add to that complexity. We have to make things as simple and as seamless as possible. How we communicate, because remember I mentioned this information overload or information fatigue. We have to cut through that when we're actually communicating with individuals about what their next step can be. Be personal, be repetitive, be clear. There's a lot of options out there. And I know that one of the main objectives that we have in our organization, TELUS Health, is to simplify that journey. Be that first step and provide the type and level of support that where you might be at that moment. You can't be, or you shouldn't be expected to be the expert in whether you go to this app or this therapist or here or there, or, whether you're going to have support that matches your own cultural identity or other identity. So we take that off of you. And really the best mental health supports, even outside of us, focus on that simplicity to reduce people's anxiety so they feel that they have that sense of control when they're getting support. So it's a really important part of any kind of support philosophy and something we take very, very seriously.
Yeah, like Paula, when I think of the world getting more complex, that's when we need to simplify things and remove barriers for people. And so getting back to that simplicity means, getting back to basics, human connection, reducing social isolation, the importance of community, the importance of culture, anything that we can do to take away the barriers between people and those things that are healthy for them is what we seek to do. And so that means like making sure that accessing services, accessing support is easy, that every door is the right door, or that there's just a single door so that you're always getting to where you need to be. The back end, all the things that happen in the background can be complicated, but that front end, what actually faces the individual that's needing that help and that support in these complicated times, that part needs to be simple. And that's certainly a sort of unifying characteristic of our work.
And if I could just add one more thing, when people are faced with a lot of strain, when we have the complexity that we had mentioned before, one of the things that really is helpful is having an experience where people regain a sense of self-efficacy, a sense of control. Right? So we don't want the experience to take that away. Like we don't want a care experience to sort of make people feel less empowered. We want the exact opposite. So even as we're providing guidance, even as we're helping people navigate through, what might be best for them based on what we know of them, nobody knows you better than you. So there is that element of choice. Some people like digital, some people like in person, some people like a combination, there's different elements of it. And we're always focused on helping people learn probably things that they already know. We have gone through different things in life and we often forget the skills that we have built when we're feeling overwhelmed. So really sort of bringing forward in the counseling process, in the education process, learnings that'll help people go back out into this very complex environment is also a really important part of whatever path is taking.
Right. Great points. We're clearly at an inflection point where traditional workplace support models, many designed decades ago, are struggling to meet today's realities. And just going over all of these topics like the changes in hybrid work and generational shifts that we haven't seen before. I'd be curious to know, maybe Matt and then Paula this time, as you look across the global landscape, what fundamental shifts do you see happening in how organizations need to think about employee well-being?
Yeah, there's a couple of shifts that we're seeing. One is this idea of shifting towards prevention of issues, prevention of challenges, prevention of crises, rather than simply reacting to crises. And for a long time, whether it's employee health, employee well-being, benefits, even entire healthcare systems at a national level, it's been around sick care, right? Helping people when they're sick, catching them when they fall, creating a safety net for folks. And so one of the largest transformations we've seen collectively is that shift towards prevention and recognizing that there are factors that we can address for people, whether it's workplace culture, social connectedness, psychological safety, physical health interventions, the prevention of chronic disease that can mitigate a crisis before it even happens. And certainly that's an important transformation. And then earlier, Paula also mentioned this idea of creating many different types of access points depending on people's preference. That's also been a key change, is seeing a plethora of different avenues for people to get support, whether it's preventative support or acute support or crisis response, recognizing that we're all different individuals. We have different needs, different preferences, different ways that we want to access care, and seeing that personalization and customization come to the fore.
Yeah, absolutely. And if I were to put my finger on when the biggest change happened, it was actually at the beginning of 2020 with the pandemic. It was, prior to that, we had kind of been moving towards that prevention approach, focusing more because it only makes sense, right? Like, the business case is much stronger when you catch anything earlier. But there was an awareness in workplaces that came to the minds of business leaders that, oh my goodness, my business is not going to survive if my people are not in a good place. And all my people, if they're not in a good place. It's not just the ones who historically, we would consider struggling. It's not just the ones who might be at risk of going on disability leave. I've kind of taken for granted that my workforce was focused and able to perform. And now this big thing has come forward that makes me not take it for granted anymore. So really, we started to see that investment that kind of moved away from the crisis response, which is still very important, the in-depth response, which is still very important. We're not forgetting that, but building on top of it, preventative things and well-being initiatives. So even moving from wellness, which is more around that preventative risk and activities that you do, to more the psychological state of well-being and making sure that the workplace is contributing to that well-being. The reason why we work is to improve our quality of life, to give us a sense of purpose, to give us finances, but also that quality of life includes the time that you are at work. So the support that you get, the services that you get, your relationships at work, all of the things that actually help overall well-being has really taken a forefront, and that was not the case several years ago.
Well, Paula, you bring up some important points that I feel like I hear a lot across the behavioral health tech community, whether it's a founder of an early stage startup or even more established companies. Just across the board, it feels like business leaders are sitting at the crossroads of caring for their people as humans, but also driving results for their business. And of course, it's a challenge. And so I would love to hear if you could share any specific examples from your experience where you've seen a leader or organization transformed what seemed like these competing priorities into some kind of unified strategy that delivered both human and business outcomes, because I do know a lot of businesses right now are feeling the pressure.
Yeah, I'll answer that question maybe in two parts, if you'll let me. Let's start with the research part of it. We publish a mental health index. We do so globally, Canada, US, EMEA, APAC, all over the world. And we look at different trends, the state of mental health and well-being in the working population, and the things that do make a difference, positively, negatively, and the things that don't make a difference. So not long ago, what we did is we looked at individuals and work teams who had better mental health scores and higher discretionary effort, which leads to higher productivity. That little bit extra in terms of energy that you put into work, that's the discretionary effort. So things that all organizations would want: better mental well-being, discretionary effort, productivity. So we looked at those employees and teams who had the higher scores compared to the ones who did not. And there were 5 factors and behavioral traits really that really came across very strongly from their leaders. So this is how their leaders behaved on a consistent basis. Those leaders were empathetic. They actually cared about people as people, and they cared about their well-being. They were inclusive. So they made people feel safe as individuals and accepted people as individuals and cared about opinions. It wasn't just going to 1 or 2 people. They were team-oriented, so they talked about the team. They really were supporting the team. They encouraged members of the team to collaborate and help each other when there were difficulties, as opposed to fostering competition between team members, and they themselves acted and spoke of themselves as part of the team. The other 2 were that they made decisions quickly. So they didn't leave their teams in limbo, because again, we don't like uncertainty as human beings. That elevates our stress. And they had a sense of purpose. And remember, before I had mentioned purpose is important. They had a sense of purpose in the work that was being done. They were proud of the work that was being done. They felt that the teams were doing things that were important, and that came across and actually helped them be described as charismatic. So those 5 things statistically significantly made a difference between the higher functioning and the teams that were struggling. Now, the good thing about that is that we've determined quite clearly that all of those things are trainable. Just bringing it to the awareness of leaders changes their behavior in a positive way. But when you train them, when they actually develop some skills and some role playing about how that can be demonstrated, it's brilliant. So that's the research base. The other part of it is that we work with a number of organizations in the US, globally. And when organizations take that training and investment in managers seriously, the results wrap around the world twice. One of the first organizations that did this made that mental health training for managers mandatory. So rather than having it available, you can come when you want, it's kind of good, you might get stars or points, it was considered, part of the essential business skill package. So everyone from the senior executives right down to the line managers went through training. And what we saw is that their EAP utilization went up. They were able to refer, they reduced stigma, the people were accessing more proactively, and their sick days went down 20%. So it really had that strong impact in changing the culture, changing behavior, and enabling people's access to support. So, win-wins for everybody.
And to reinforce those great points that Paula has, made, I'm going to bring up the story of our own organization, TELUS. We are a large multinational organization that, in addition to providing health services, also provides telecommunications and artificial intelligence development and data analytics. And, just to be clear, even for us, we're still on a journey to getting this right. And, that journey started with a recognition that, like Paula has stated very eloquently, this meaningful efforts towards ensuring the well-being of your organization drives those hard business outcomes. So we established, for example, some of the nation-leading access to mental health benefits for all of our team members, and we saw absence and disability rates drop. Then we implemented a number of well-being initiatives. Again, that's the same trend. Absence to disability rates dropped. Presenteeism became less of a factor. People were able to drive those hard business outcomes while maintaining their personal well-being. Then we implemented a program called Work Styles, which essentially says we care about what you contribute to the business and your performance more so than how and where you work from. And we implemented that program long before the pandemic, long before this idea of flexible and hybrid work became popularized. And we've continued that for all that time since. And that has also helped us to drive those hard business outcomes while also recruiting some of the most diverse and talented staff across the world, especially in international locations. So, and then finally, in the last piece of our journey, this is a point, I think, of where it's critical to reassess and reevaluate what you're doing and seeing what's working and what's not. We got some feedback that people are feeling a little bit disconnected sometimes with the impact of their work on society, and it's particularly in our health division. And so what we've introduced is well-being moments and patient stories. And so at the beginning of a town hall or a leadership team meeting, or even individual, more granular team meetings, we actually lead off with a story where a patient, a client, a customer, an individual, a family member has benefited from something that we have done as an organization. And that could be something that the programmers did, the software developers did, the AI development team did. It doesn't have to be a frontline clinical person, so that they can see the impact, really experience the impact of what their work is on society and these broader outcomes. And so that's a learning for us. That's going to become incorporated into our story of how we sort of balance well-being with the business outcomes, and it's an example of our commitment to getting this right.
Matt, you had so many great points just there. Everything from including the lived experience and showcasing that for colleagues, to the focus on your multinational reach. If I could just double click on that point a little bit. When it comes to working with global organizations, how are you balancing clinical excellence with this idea of nuanced cultural understanding that these different regions require, especially when mental health stigma and approaches really vary so dramatically across cultures?
Yeah, that's a great question. And I think it's something that has likely defined my career and Paula's career is how do you translate globally recognized evidence-based, science-based standards into something practical for people on the ground. And the way I like to think of it is the science and the evidence around clinical excellence, that's your framework. Mm-hmm. But that framework is barren until you actually start hanging things off that frame. And what are you hanging off that frame? You're hanging lived experience. You're hanging cultural appropriateness. You're hanging deep understanding of the regional and local and geographic and cultural nuances of the people that you're serving. And how do you do that? Because that's a complicated thing to do. I'm going to take the risk of oversimplifying it a little bit, and then Paula's going to keep me honest. But one of the most important ways that I've experienced about how you take that frame and make it real for people and make it appropriate and drive those outcomes you want for people is you make sure that the team, that whether it's your programmers, your AI developers, your clinicians, your supporting team members, even your executives, you make sure that team looks like and reflects the people that you're serving. Because when you do that, you bring in that rich lived experience of different cultures, different approaches to mental health, even different language around how you approach workplace well-being and mental health. And so your products, your agentic agents, your clinical services, your 24/7 crisis line, all of that is going to be much more nuanced and much more in tune with the people you're trying to serve than if you are, quite frankly, guessing what people need because your organization that's delivering that service does not reflect, does not look like, does not have the lived experience of the people that you're attempting to serve. So I'll put that out there. I actually would love to hear Paul's reaction to that because it is such an important question you've asked and such an important part of what we do.
Oh, well, absolutely. And, there's many layers to this, but again, at the risk of oversimplifying it, I'll sort of, put three. As an organization, there's certain things that are non-negotiable. There's our integrity, trust, high clinical quality, all of these things, being very, very client-centered, being research-driven, all of these things are important as our core. But we also don't deliver in Turkey from the US. As Matt said, we deliver locally. We make sure that we have local clinicians, we have local account support, we have local people who understand the culture and are serving the people that they are living and working with every single day. And so that allows us to have that balance. And from a central point of view, even while maintaining those standards, we have to have, and we've learned to have a lot of humility, because not everything that works in one place is going to be as effective in another place. So it is that constant learning and listening. So those are the two points. The third point is inside everywhere, there is a lot of diversity. So you can't say, well, to take my example, I know about Turkey, so everybody in Turkey is going to be treated in a particular way, or everybody has that same lived experience, just like you can't say that for Canada, UK, the US. There are so many different identities, cultural backgrounds, intersectionality, different levels of things that, are expressed in counseling. That's why we also make sure that wherever we are, there is that fundamental expectation and training and supervision and support for inclusive counseling. So understanding your own personal assumptions and biases, which is good counseling, which is one of the foundations of good counseling anyway, making sure that people feel safe and bringing that humility into the relationship as well. So you're listening to where people are starting. Because, you could have, somebody who is half Guyanese, half Norwegian, who is Catholic, who has transitioned to, another religion. Like, there's so many different beautiful complexities of human beings that each one of us has to have that kind of broad, global, inclusive perspective if we're going to be effective in a helping profession. Actually, any profession, I would say.
It's a good point. Exactly. You never know who you're going to come across. Maybe they're half Polish, half Ethiopian from Minnesota living in Scottsdale. Not that I would know anyone like that.
Absolutely. To top up on Paula's comment, I might add that this cultural nuance and this appreciation or respect and honor for this diversity is equally important in the digital space as it is in, let's say, direct one-to-one traditional counseling therapy. And sometimes people forget about that. But when you're creating an agentic AI agent, when you're creating an AI chatbot, even if you're just creating a tool that reduces sort of administrative burden, it's equally important to make sure that you've incorporated all these different perspectives, to actually reduce the risk that you're missing the mark, quite frankly, with these services. And that's certainly something that we invest in, is making sure that our digital teams are as aware as our, let's say, front-facing clinical teams.
Such good points. And Paula and Matt, there's so much more I would love to ask you, but if I could just touch on one more thing that has come up throughout this conversation and is so important for the business leaders that are listening in, is this idea that, they're thinking about ROI, but human well-being can feel very intangible. How are you helping organizations measure and communicate the business impact of these employee care initiatives? And maybe could add what metrics have been most compelling to C-suite executives?
So there's a number of ways to measure, and that's sort of built into our process as well for two reasons. Number one, people trust us and hire us for a reason, and we have to make sure that we're living up to that reason. Like, it's very important that if we are off track with an individual or a group, that we understand that early on so we can take corrective action. And also, we do know that some of our sponsors have to justify some of the investments that they make. And also, if the investments are a little bit weak in certain areas, then that's another point for corrective action. So we have a three-step approach. Like, one step is really just making sure that everything is in place so we have the possibility of having impact. So there's communication, there's quality standards, there's doing everything That'll get you what you need. So that's not really sort of the measurement, but that's an important part of the whole framework. The other is every single interaction has an objective to improve the life of the individual that we're dealing with in some way, shape, or form. Some it is a clinical improvement, some it is self-efficacy, it is whatever that person is bringing to the table, but there's always a goal. So we measure the pre and post of that goal. Where do people start and where do they end up as a result of our interventions? And as part of that measurement framework, we also measure the impact on their work and their productivity, because most of the work that we do is with organizations. So increasing their focus, increasing that discretionary effort that I had spoken to you about, their view of the workplace, actually, we see changing as well. Quality of life, or actually not so much quality of life, although it's related, but that sense of life satisfaction, because that is a resilience factor as well. So we measure that and we report on it back to the organizations, obviously on an aggregate basis. So that, again, we know that that's on track. So we have that invested, we have benchmarks, we have massive amounts of data globally with respect to that. And it's really about that commitment to having the impact that we intend to have.
Yeah, absolutely. I like to approach this idea of making the intangible tangible by, honing in on the pain points that the various executives I speak to have. If it's a CEO, I remind them about that time that they were making a very tough business decision, and they needed to make sure they had all the data that necessary to make that decision. And then we talk about psychological safety and how that impacts on your staff's and your team's willingness to give you that data, to present that unvarnished view, to make those critical decisions as a chief executive. And so why, well-being initiatives support psychological safety. When I talk to a CHRO officer, we're talking about their absence and disability rates, their health benefit spend, and how that's been rising over time, and how well-being and preventative initiatives in particular reduce that spend, actually bend that cost curve back down for them, which is critical to driving the outcomes that the CHRO needs. Then I talked to a CTO. They're experiencing a war for talent. They're trying to find the most talented AI developers, let's say, around the world. And so we talk about how, especially for new generations in the workplace like Gen Z or Gen Z, that workplace meaningful work, having purpose to their work is so critical. It's actually critical for everybody, but particularly for new generations in the workplace, and how a focus on well-being, a focus on bringing purpose and meaning into the work and communicating that to people is, might be seen as an intangible or sort of a soft thing to do, but actually becomes critical when you're in that war for talent and you're fighting to get the very best people working on your products and services from around the world. So I try to make it real for people. There's the measurements, there's the outcomes, and then there's the pain points that the executives face, and how working on well-being and investing in well-being actually makes a difference to address those points.
If I could add something, when you said the phrase, the pain points that executives face, there's another angle to it that we've looked at as well. Not long ago, what we did is we did a massive study. We had responses from 1,200 senior executives. So that was 1 or 2 levels below a CEO, depending on the size of the company. And we found a massive amount of strain. The level of strain in that group was higher than line managers, higher than employees. And they actually communicated that they felt that the rules were a little bit different for them. They felt that there was a barrier to them seeking care and support. They were all super high performers. So, it wasn't so much that the work was declining. They might actually create some anxiety around people around them, because what tends to happen is, if you are a perfectionist, you become obsessively perfectionist. If you have high energy, whatever your superpower is, it becomes really, really overwhelming in high performers, which sometimes causes some anxiety with people around them. But they were damaging themselves and not getting support. And when we did this study, just bringing it out in the open opened a floodgates. The number of responses that we got, we got newspaper coverage, we had personal DMs come to the researchers around, thank you. At least now I don't feel like it's just me. I don't feel like I'm alone. I feel like I can take my first step. So, executives are people too, but, and with all the love in the world, I'll say that sometimes they have to remind themselves that they are. And this study sort of reminded them that they are. And the other thing is that one of the studies that we did in the mental health index, we looked at people's concern of the mental health of their children and found about 30% are very concerned about the mental health of their children. So it was 31% when they were school-age children, 30% for teenagers, and only slightly less, 28% for adult children. So when you think about it, those executives, they might have teenage or adult children who are in or are moving into the workplace. And I would think that they want to have the healthiest environment and the most support for them as possible. And the last thing that I will say is with everything that we're saying about ROI, we also save lives. There isn't a day during the time period of this podcast, we've had people contact us who are at risk of dying by suicide. And what kind of dollar figure can you put on that?
Just remarkable. Thank you, both of you, for sharing such powerful stories. And I definitely want to be sure that our audience can get access to some of these resources that you mentioned as well. So we'll be sure to include those in the show notes here. And Matt and Paula, just even the quantity of organizations that TELUS Health has helped really lends itself to all these insights that you've been able to share with us. So really thank you for sharing your expertise and time with us. And for those in our audience, if you like what you heard today, I'm excited to share that there'll be more of this happening at the Behavioral Health Tech Conference. So of course, save the date, and looking forward to seeing Paula, Matt, and many other behavioral health and employee well-being leaders. Thank you so much.